At SIH, patient satisfaction begins with the nurse-to-nurse report, engaging the patient and providing a professional transfer of responsibilities. This video will walk you through the steps of the bedside report using the shared tool. The charge nurse prints shared tools and places them in a designated location. As a nurse arrives, they get assignments and pick up their updated shared tool. The incoming nurse finds the outgoing nurse for a report and verifies that the shared tool is updated. If not, the tool must be updated by the outgoing nurse before they leave.
There's something I wanted to share with you before going in. She's asked that if her family's here, we ask them to step out during report. So if they are, I'll go ahead and talk to them. All right? Mrs. Jones? Hi.
Hello.
Okay. Mrs. Jones, this is Angie. She's going to be taking care of you today. We work together as a team while we're here, and you're part of that team. So I just want to give her a little bit of report.
Okay.
Tell her, you know, what brought you here, what we've done since you've been here, and what we plan on doing today.
Do you mind if I turn the TV off?
Oh, sure.
Just so we can hear each other.
Right.
All right. So since you're a part of our team, if I forget something, you just jump in and let me know.
Okay.
If there's anything that you'd like to add, you know, go ahead and speak up because we want you to be included on the plan, all right?
Okay.
So Mrs. Jones is a patient of the hospitalist, 34-year-old female. She was admitted to the ER last night. She had some right facial swelling, so they diagnosed her with facial cellulitis. So from us, she is going to get Vanc every 12 hours, 1 gram, and she's going to get Zosyn every 8 hours, 4.5 grams. She's got a 20 gauge to her right AC. She's getting normal saline at 100 in between. She will be NPO at noon, but she's on a regular diet as of right now. Downstairs they did blood cultures ×2 and they did a gram stain. She's allergic to penicillin and sulfa, so we've got her allergy bands on her for that. But for nausea, she can have Zofran. For pain, she can have ibuprofen. Right now, she's rating her pain about a 2 on a scale of 0 to 10. So I'm doing okay with that. Relevant to this day, she's had a history of MRSA before. She had an incision to her left forehead, and that was infected, but when they did the blood cultures and everything came back negative, so she's not on isolation. Otherwise, she has a little bit of anxiety. She's had a hysterectomy, and when she was about 2, she had an atrial septal defect repaired. No residual effects from that. So she is a smoker. I don't know if I told you that, but she's got a nicotine patch, and we did some education on smoking cessation. So I think that's about it as far as her history. Now today she's going to meet with the surgeon. We were talking about some outpatient antibiotic therapy. She's going to get a port placed today and then follow up outpatient at maybe St. Joe's or something. Okay? Does that sound about right to you?
Yes, it does.
Okay. Is there anything that you'd like to add?
I was just wondering if I get antibiotics before I leave.
Before you go, we'll continue your antibiotic therapy here, and then
Okay.
Angie will go over all the discharge instructions with you should they choose to send you home today, and like when your follow-up appointment will be as far as continuing the antibiotics afterwards. Okay? All
Sounds
right.
good.
I'll be your nurse for the next 12 hours. Is there anything that I can do to help you accomplish your goals for the day?
I don't think so. I just want to get out of here.
The oncoming nurse will also update the whiteboard with the nurse's name, phone number, and what the patient would like to accomplish that day.
I have some other patients I have to get report on, so I'll be back in about 20 minutes to listen to your heart and lungs. Is there anything that I can do right now for you?
Not right now. I'm happy.
If you think of anything, you know how to use your call light. The red button gets us, and I'll be back in about 20 minutes, okay?
All right. Thank you.
All right, thanks.